So hello everyone, our today's topic is type of WBC. Now WBC classification, we can classify them as either granulocytes. Granulocytes are the one that would contain granules. Example are the polymorphonuclear leukocytes that contains neutrophils, eosinophils as well as the basophils. The non-granulocytes or agranulocytes are those without granules. They can be monocytes, basophils, etc. Now the lymphocytes, they can be T cells, B cells, natural killer cells, etc. Now remember, the granulocytes formation, it is known as granulopoiesis, and the site is, remember it, the site is bone marrow. So it undergo a number of stages, that is proliferative pool that consists of myoblast, promyeloblast and myelocyte, and maturity pool that consists of metamyelocytes, band forms and the segmented neutrophils. Now remember that granulocytes, they spend around 10 years in blood. The granulocytes, they spend about 10 hours in the blood before moving to tissue. The blood pool, it has two parts. The one is the circulating pool and other is marginating pool. Now remember that granulocytes, they live in tissue for 4 to 5 days. The granulocytes, they live in tissue about 4 to 5 days. Whereas the monocytes, the granulocytes, they live for 4 to 5 days in the tissue, whereas the monocytes, they have a circulation time of around 20 to 40 hours in the blood. Now let us discuss about the development of the myeloid cells. The first stage is the myoblast stage. So it has a size of, remember, it has a size of around 10 to 18 micrometer. The nucleus here is a large, round to oval. The cytoplasm is deeply basophilic with containing no granules. Now remember, in the case of acute myelocytic leukemia, all rods may be present. Now remember that in acute myeloid leukemia, there may be present of your rods. The next stage is promyelocytic. So the nucleus is round to oval with a slightly condensed chromatin. Here the cytoplasm would contain azurophilic granules, also known as primary granules. The next stage is of myelocyte. The myelocytes, there are present secondary granules. The nucleus is eccentric, round to oval with chromatin and no nuclei is seen. The next is the metamyelocytes. Remember, these metamyelocytes, They are horseshoe shaped nuclei with no nucleoli, dense chromatin. So they contains both primary as well as secondary granules. The next stage is the band form. It contains condensed chromatin band shaped configuration. It contains granules. The last stage is mature neutrophil. The segmented granulocytes that the type are neutrophils, eosinophils, basophils. So similarly, there is development of the monocyte macrophage series that includes monoblast, promonocyte, monocyte. Sequential development from the myeloblast, promyeloblast, myelocyte, metamyelocyte band form to mature segmented granulocytes with increased nuclear chromatin condensation and the granule formation. Similarly, in the monocyte macrophage series, from monoblast to promonocyte to mature monocyte that involved in phagocytosis and secretion of various active products. Now the lymphopoiesis, remember what are the primary lymphopoietic organs? Remember that bone marrow, it produces lymphoid stem cells. Thymus, it is site for T cell maturation. So these are the primary lymphopoietic organs, whereas the secondary lymphopoietic organs are the spleen and gut associated lymphoid tissue. The immature lymphocytes, remember, they migrate to other organs where they undergo development and are influenced by local factors. Now, what are the lymphocyte functions and type? The lymphocytes could be T cells that are involved in cell mediated immunity. The site of production is bone marrow and thymus. The B cells, they are involved in, remember, humoral antibody response, and site of production is bone marrow and the bursa fabricus. So after activation, the B cells become plasma cells, and these plasma cells would secrete antibodies. Other are the natural killer cells. They are part of innate immunity, so they do not have B or T cell marker and they are not thymus dependent for development. So remember, the primary organs, the bone marrow and thymus, they produce lymphoid stem cells. The secondary organs are the lymph nodes, spleen and gut associated lymphoid tissue that produces lymphocytes in response to antigen. Now let us discuss about granulocytes. The first are the neutrophils, polymorphoneutrophils. They have a size of around 12 to 15 micrometer. The nucleus is dense and it is 2 to 5 lobes. The cytoplasm is pale with numerous fine pink granules. Now, what are the types of granules that you would see in neutrophils? The primary granules, we discussed that they are known as azurophilic granules. So they are large and coarse. They contain hydrolase, elastase, defenses protein, etc. Other are the secondary granules. They are smaller and more numerous. They contain lactoferrin, NADPH oxidase, vitamin B12 binding protein. Now, what is the normal function of these neutrophils? The main function of neutrophils is chemostaxis, that is attraction toward the bacteria or the site of inflammation. Other important role is they engulf and digest the foreign material. So they act as a macrophages, while monocytes they act as a macrophages. So the killing of microorganism, it is mediated by both oxygen dependent and oxygen independent pathway. Now neutrophils, when there is increase in neutrophil count, the term we use is neutrophilia. What are the common causes of neutrophilia? Remember that acute infections like pneumonia, meningitis, diphtheria, plaque, actinomycosis, abscess, furuncles, carbuncles, tonsillitis, all these are common cause of neutrophilia. Intoxication like uremia, diabetic ketoacidosis, acute hemorrhage, that could be another cause. Neutropenia is defined as when the count is less than 2500 per microliter. The cause could be typhoid fever, influenza, measles, viral hepatitis. The drugs involved could be chloramphenicol, cotrimazole, anticonvulsant, various hematological disorders like pernicious anemia, aplastic anemia, that could be the cause. Now, what would be the variation in a neutral morphology? First of all, you can see is toxic granules, like in the bacterial infection. You can see vacuoles, cytoplasmic vacuoles, or you can see is Dohle's body. They are seen mostly in the bacterial infections, so they are generally seen in the cytoplasm. Apart from that, you can see the nuclear abnormalities like the drumstick appendage of chromatin. There might be shift of neutrophil segments to left when they have a fewer nuclear lobes. The condition are severe infection, and there could be shift to left. Shift to right means there may be appearance of when there is more than 5 lobes, then we call it as hypersegmented neutrophils. Remember, hypersegmented neutrophils, they are seen in megaloblastic anemia, uremia, and sometimes you see them in leukemia. What are the defective neutrophil? When there is a defect in a neutrophil function, like there would be defective chemostaxis, the condition could be lazy leukocyte syndrome. When there is defect in phagocytosis, the cause could be lack of opsonization. That could be due to hypogammaglobulinemia, sickle cell disease, etc. When there is defect in killing condition, the condition like Chediak-Higashi syndrome, myeloid leukemia. The next are the lymphocytes. Lymphocytes, they have a round and slightly coarse clumped chromatin. The cytoplasm is scanty and basophilic. They have example are the plasma cells. They are derived from B lymphocytes and they are present with eccentric nucleus. That means the nucleus is on one side and show cartwheel pattern of clumped chromatin. The lymphocytes can be T lymphocytes. The T lymphocytes, they have origin from their thymus dependent. The T lymphocytes they are thymus. They are involved in cell mediated immunity. Other are the subsets include the cytotoxic T cell or delayed hypersensitivity T cell. Other are the B lymphocytes. They are bone marrow dependent and originates from bursa fabricus, and they will produce immunoglobulin antibodies. Other are the natural killer cells. They are part of innate immunity and they will directly kill the microorganisms. Now the lymphocytosis, it is a condition when there is an increase in the lymphocyte count. When there is greater than 4000 per microliter count, the causes could be acute infection like pertussis, infectious mononucleosis, viral hepatitis, chronic infections, hematopoietic disorders, a relative lymphocytosis, etc. Whereas the lymphopenia is decrease in the lymphocyte count below 1500 per microliter. It is seen in most acute infections where bone marrow failures, etc. Other are the monocytes. Monocytes, they are the largest mature leukocytes in the peripheral blood. They have a horseshoe shaped nucleus with a fine reticular chromatin network. They have abundant cytoplasm and vacuoles. The function of monocytes is they play a role in phagocytosis. They have an immunological function and they release prostaglandin, stimulate the liver to secrete acute phase reactants. So they act as a mediator of inflammation. Now the increase in monocyte is monocytosis seen in bacterial infection like tuberculosis, subacute bacterial endocarditis, viral infection like malaria, typhus, kala azar, hematopoietic disorders, malignancies, granulomatous disorders, diseases like sarcoidosis, etc. The other are the eosinophils. So remember they have two lobes. They are bilobed. They contain deep red staining granules containing basic proteins. The function of eosinophils, they are involved in reaction to the foreign proteins and antigen antibody reaction. The increase in eosinophil count is known as eosinophilia, mainly seen in allergic disorders like bronchial asthma, angioneuritic edema, hay fever, seen in parasitic infection like echinococcosis, etc. Skin diseases like pemphigus, erythema multiforme. So they all could be the causes. Eosinopenia is the decrease in the eosinophilic below 40 per microliter and it is often induced by adrenal steroids and ACTH. Basophils, remember basophils, they resemble like other mature granulocytes. They contain coarse basophilic granules. They contain heparin, histamine, their other tissue counterparts are mast cells that release histamine on a degradation. Basophilia is the increase in the basophilic leukocytes above 100 per microliter. It is seen in chronic myeloid leukemia, polycythemia vera, myelosclerosis, ulcerative colitis. Remember all the cause flow, Hodgkin disease, urticaria, etc.